In the medical industry, there are many disciplines. They all share the goal of improving, saving, or changing lives. Join us as we meet the people, discover the technology, and explore the organizations of this vital industry. I'm Terry Bradshaw. This is Health Briefs. Technology that helps us do things better, faster, and more efficiently is emerging all the time. Here's something new that could potentially improve our lives. Right now, millions of people around the world are either suffering from or are at risk for heart, lung, or kidney failure. In a way, these people are ticking time bombs, living day to day with silent killers. Some doctors believe the best defense against failure is through more sensitive and patient-specific blood tests. Such tests would be able to predict, diagnose, and monitor the impact of care on patients.
Chronic diseases related to kidney, heart, and lung failure will comprise more than 40% of all deaths worldwide and will be the leading causes of hospitalization throughout the world. Early detection and prevention of these conditions are the most effective way of preventing this kind of epidemic from happening.
Heart, lung, and kidney disease exert an enormous negative impact on our patients and their communities. In the later stages of their diseases, our patients may be tethered to an oxygen tank or to a dialysis machine. Their weakened hearts may not allow them to complete even the most routine household tasks. Our innovative diagnostic technology should allow earlier detection and more effective personalized treatment.
The Proof Center has developed new blood tests for those who may be prone to heart, lung, or kidney failure. Founded in 2008, the unique not-for-profit organization helps doctors better detect whether a patient is at risk for, has, or is progressing with organ failure, as well as how well they respond to therapy.
The mandate of the Proof Center is to develop new, effective blood tests for defining risk or the presence, progression, response to therapy for patients suffering from heart, lung, and kidney failure, deriving these tests from thousands of molecules in the peripheral blood and reducing them to a signature that's characteristic of each individual patient.
The Proof Center's blood tests allow doctors to provide more personalized, accessible patient care. Through earlier diagnosis, the test can lead to earlier intervention and improve a patient's chance of recovery. In some instances, the blood test can replace or reduce costlier and more invasive procedures such as biopsies. Because the test can be used outside the hospital, health professionals in rural and remote areas are able to perform the same analysis as urban centers.
The most cost-effective way of preventing organ failure is to detect it early and intervene aggressively. The Proof Center of Excellence will do this by bringing together experts from all fields of the healthcare sector and develop novel blood tests that clinicians can use in their own offices to enable them to detect early and intervene aggressively and thus prevent organ failure for their patients.
The Proof Center believes that collaboration is essential to creating momentum behind the personalization of healthcare. The organization works with scientists, industry specialists, healthcare professionals, and government leaders from around the world to define and refine its patient-driven innovation.
Working with Proof is an absolute necessity when bringing new medical innovations to market. They have access to physicians, patients, laboratorians, and all of the resources that are required to bring these new discoveries to market. We're very, very happy and pleased to join many other collaborators around the world in coming together at Proof to help patients.
The Proof Center's vision is first and foremost to relieve suffering. We're focused on developing the highest value blood tests possible in the shortest period of time with the most effective use of resources, working collaboratively with partners, and setting an industry standard in that regard, making sure that the tests get into the hands of physicians and other caregivers worldwide.